Lactulose is a non-absorbable synthetic disaccharide made of galactose and fructose, and lactulose cannot be metabolized in the small intestine, so it reaches the large intestine unchanged, and that is where it gets metabolized by the colonic bacteria to monosaccharides and then to fatty acids, hydrogen, and methane. Now, once the lactulose is metabolized to monosaccharides in the colon, the monosaccharides act as an osmolyte that draws water out of the colon wall, and that is an osmotic effect. And it also leads to increased gas formation in the large bowel because lactulose gets metabolized to methane, which is a gas. Now, the more water that resulted from the osmotic effect and the more gas that resulted from the methane in the colon, they lead to laxative effect. And laxative effect means increased in bowel movement because of the more water and gas available, and this would lead to reduction in transit time, and by this mechanism the lactulose work to treat constipation, and lactulose is classified as an osmotic laxative. So by this mechanism lactulose work to treat constipation, and it is FDA approved for this indication. Now, also in the mechanism of action of the lactulose, when the lactulose is metabolized to short-chain fatty acids such as the lactic acid and the acetic acid, this would lead to a reduction in the pH of the colon, which facilitate the conversion of ammonia, the NH3, into ammonium, which is the NH4+, in the large intestine. Now, the ammonium, the NH4+, would not diffuse to the bloodstream as much as the ammonia, the NH3, diffuses because the ammonium has a charge. And remember, charged molecules has a hard time crossing membranes. And the ammonium also can't cross the blood-brain barrier for the same reason, because it's a charged molecule. Now also, the acidic pH that resulted from the metabolism of lactulose to short-chain fatty acids also work to destroy the urease-producing bacteria in the colon that is involved in the production of ammonia. And because we have less ammonia-producing bacteria, this means we have less ammonia produced. And also, the lactulose inhibits the intestinal glutaminase activity, which blocks the conversion of glutamate to glutamine and its metabolism to ammonia. And this also means we have less ammonia produced. So by these three mechanisms mentioned, the lactulose work to lower the blood ammonia and treat the hepatic encephalopathy, and that is also an FDA-approved therapeutic use for this medication. And these three mechanisms, again, they include that the lactulose facilitate the conversion of ammonia to ammonium, which is a charged molecule, and it cannot cross the biological membranes. And also, the lactulose work to destroy the ammonia-producing bacteria, and it also works to inhibit the intestinal glutaminase activity, which blocks the ammonia production by blocking the conversion of the glutamate to glutamine. So the lactulose is FDA approved for prevention and treatment of hepatic encephalopathy, and it decreases the blood ammonia levels by 25 to 50%, and this improves the patient mental state. And it is also FDA approved as a third line in management of chronic constipation, and that is after the lifestyle modifications and increasing the fiber intake have failed. Now, regarding the off-label therapeutic uses of the lactulose, so they include the management of the subacute clinical encephalopathy, and also the lactulose, because of its ability to reduce the intestinal transit time, the lactulose can also reduce the deoxycholic acid's hypersaturation, and this would lead to inhibition of the cholesterol stone formation. Now let's move on to talk about the pharmacokinetics of the lactulose. So the lactulose is available as a syrup for oral administration, and it is also available as a rectal enema. And the lactulose is poorly absorbed from the gastrointestinal tract, and it works locally there to produce its effects, and less than 3% of the total dose is absorbed to the blood and excreted through urine. Now let's talk about the adverse effects. So, since the lactulose does not get absorbed into the blood, this means that it produces side effects limited to the gastrointestinal tract. And the most significant side effect is the diarrhea, and the diarrhea is dose dependent and decreases in severity with dose reduction. And diarrhea may lead to electrolyte disturbances. Now, lactulose also may lead to increased bowel sounds, increased flatus, and sensation of bloating. And it is important to understand that the lactulose is contraindicated in galactosemia patients requiring galactose-free diet. And it is also important to mention that the sorbitol is superior in treatment of constipation in elderly patients. And as we mentioned again, the lactulose may lead to electrolyte disturbances because of causing diarrhea, and the electrolyte might require monitoring, especially in elderly and critically ill patients. And the lactulose may induce the lithium toxicity in psychiatry patients taking the lithium, and that is due to its ability to induce dehydration through its osmotic action, leading to poor renal excretion of lithium. And that is because the lithium has a narrow therapeutic index, and this also applies to other medications that also have a narrow therapeutic index that are co-administered with the lactulose. And with that, we reach the end of this video. Thank you guys for watching. Please give us a like, comment your ideas and questions, and subscribe.